Welcome to the Smart Weight Loss Coaching Podcast. I'm Dr. Lisa Oldson, a board-certified weight loss medicine specialist and certified life coach. In this podcast, I'll share fresh insights and effective techniques for incorporating mindset, habit change, and proven science into your life. Are you ready to achieve sustainable weight loss, wellness, and longevity? Then let's jump in and lose weight the smart way. Welcome back. The hottest new weight loss drug isn't an injection, it's a pill, and it could change how millions of people lose weight. Let me tell you about Andrea. She's a 45-year-old woman who's seeing me for weight loss. She's committed to working on habit change, focusing on the 4 pillars of weight loss, which are nutrition, movement, sleep, and stress. She slowly came around to the concept of a 5th pillar based on the fact that excess weight is, for many people, a chronic condition that requires both lifestyle intervention and medication. Andrea has struggled with her weight for almost 30 years, since she was a teenager, and she's ready to take the next step by adding medication to her lifestyle modification program. I invite you to join me as I look at her options. Since Andrea has a history of kidney stones, she can't take Qsymia, a combination pill containing topiramate and phentermine. This medication was FDA approved back in 2012 for weight loss. It's an effective medication that's been a bit sidelined in recent years by the success of the newer GLP-1 agonists. Also point out that it might be available in generic sometime soon. Andrea also can't take Contrave, a less effective medication that does work for some people. It was also approved back in 2012. Contrave is a no-go for Andrea because it interacts with some other medications that she takes. She tried Wegovy, the first blockbuster GLP-1 agonist medication, which luckily was covered by her insurance, but she had an upset stomach and constipation that was hard to manage, so she ultimately had to stop it. Finally, we talked about having her try tirzepatide, marketed as Zepbound for weight loss. It's highly effective and often much better tolerated than Wegovy, also called semaglutide. Unfortunately, her insurance didn't cover Zepbound, and understandably, she can't afford to pay the $500 to $900 per month price tag for Zepbound. So last week, when Orforglipron hit the news, there was a sense of optimism when Andrea and I spoke about her future options for medication. Today, we're going to talk about this once-a-day pill that has the potential to help millions of people lose weight without needles and without the exorbitant price tag of the injectable weight loss drugs. As we did with the weight loss medication retatrutide, which is still in development, we're going to take a moment to talk about how to pronounce Orforglipron. The honest answer is I'm not sure. I've listened to some experts mention it at conferences, and I've watched news reports about it. But what I've mainly seen is people avoiding taking a stab at the name. I've seen the pronunciation written out a few different ways. Orforglipron or Orforglipron. It might be hard to hear the distinction between them, but up for debate is whether the for or the glip is the emphasized syllable. I'm going with Orforglipron because that feels more natural for me, although that may be the British way to pronounce it. We'll find out when the FDA approves the drug and Eli Lilly rolls it out. How does this new medication compare to what we already have on the market? Not everyone can access, afford, and tolerate the popular blockbuster drug tirzepatide or Zepbound, as I've already mentioned. In clinical trials, people on tirzepatide lost about 20% more than those taking placebo, making it the most potent weight loss drug on the market as of 2025. Orforglipron, on the other hand, disappointed investors in Eli Lilly last week when its weight loss impact was announced to be just over 12%, which is far better than what was seen in the placebo arm of the trial. But it is less than the investors were hoping for. I'd like to suggest to those investors that this is nothing to cry about, but rather a result to celebrate. We'd love an effective, convenient pill for weight loss, especially if it's as affordable as Orforglipron is expected or hoped to be. Wouldn't we accept another tool in our arsenal, even if it's not as mind-bendingly effective as Zepbound? I definitely would. It's great to have options because, as we know from Andrea, sometimes there are reasons why a person can't take the medications currently available on the market. Eli Lilly is expected to seek FDA approval of this new oral medication before the end of the year. In their study of over 3,000 people, those taking the highest dose of Orforglipron lost an average of 27 pounds, which was 12.4% of their body weight. They also lowered their cholesterol, their triglycerides, and their blood pressure. All of this in what's expected to be a more affordable pill formulation of a GLP-1 agonist. Earlier this year, Eli Lilly released data on a study looking at Orforglipron in people with type 2 diabetes. Study subjects had improved blood sugar and approximately as much weight loss as we see with Ozempic. Like tirzepatide and semaglutide, Orforglipron will most likely be FDA approved for type 2 diabetes as well as for weight loss. Let's come back to talk about Andrea and her journey through the land of weight loss medication options. But before we do, we'll hear a quick word from our sponsor. Just kidding. It's still me, Dr. Lisa Oldson, physician and founder of Smart Weight Loss Coaching. If you're as focused on your health as you are on the scale, you're my person. In my online program, we'll help you establish healthy habits for weight loss, better health, and longevity. If you'd like to learn more about our affordable monthly membership, head over to smartweightlosscoaching.com. We would love to help you transform the way you approach weight loss so it takes up less brain space and frees up your time for other things you love to do. Join us to see how different a smart weight loss program can be. And we're back. Andrea, as you'll recall, was unable to take several of the weight loss medication options on the market and was priced out of Zepbound, the current leader in terms of weight loss effectiveness. She was intrigued by Orforglipron, which is expected to help people like Andrea lose approximately 12% of their weight, and which we hope will be more affordable. Eli Lilly hasn't published anything about the highly anticipated list price of Orforglipron, but it's far less costly to manufacture a pill than it is to put a temperature-sensitive liquid medication into an auto-injector pen or a vial, as they've done with Wegovy, Ozempic, Mounjaro, and Zepbound. On another note, the 10% discontinuation rate at the highest dose of Orforglipron, mainly due to gastrointestinal side effects, isn't a surprise. Not everyone can tolerate these meds. Some people do beautifully on GLP-1 agonists, but others struggle with nausea, diarrhea, constipation, bloating, or reflux. But the discontinuation rate on the highest dose of Zepbound and Wegovy was higher than what we're seeing with Orforglipron at this time, so that's really promising. When it comes out, if the price is low enough, Andrea is on board to give it a try. With 12.4% weight loss in less than 18 months, a lower GI side effect rate than the other GLP-1 meds, and the ease of a once-daily pill rather than a shot, I'm excited for this option to hit the market. By the way, in case you're wondering, as always, I'm sharing my opinion with you without any financial connection whatsoever to Eli Lilly. I never take money from drug manufacturers to represent their products, but I just like to share with you all the info about the newest and latest things about to hit the market. Now, let's jump in and talk about my top 5 reasons for you to consider weight loss medication if your BMI is 30 or higher, or if it's between 27 and 30 and you have some medical implications of excess weight, such as diabetes, sleep apnea, polycystic ovarian syndrome, high cholesterol, and so on. Reason number 1. Excess weight is a chronic condition, just like diabetes, high cholesterol, and high blood pressure. People have the most success losing weight and keeping it off when we combine habit change and lifestyle modification with FDA-approved medication. You can more than double your weight loss by adding medication to your effort. This is no different from adding meds to the healthy diet and exercise we recommend when we start someone on a statin for high cholesterol. Reason number 2 to consider weight loss meds. They help with maintenance, not just weight loss. Sometimes people freak out about the thought of being on a medication for the long term, and I get that. We do it for other chronic conditions, but for some reason, people feel differently about weight. The meds only work when you take them, so stopping medication means you'll most likely regain the weight. However, if you flip this, you'll see that it's good news. Staying on medication after you've lost the weight means you'll keep the weight off over the long term. Weight loss maintenance is hard work, and meds can give you the boost you need to maintain. Reason number 3 to consider weight loss medication. They help so much more than just weight. We have data showing that various weight loss meds lower the risk of heart problems, kidney problems, they control type 2 diabetes, reduce sleep apnea, and lower the risk of certain types of cancer. Excess weight carried over years can cause so many health problems. Even things like back, knee, and foot pain may improve with weight loss. Reason number 4 to consider weight loss medication. We have choices. With our current toolbox of medications brimming with strong options and Orforglipron and retatrutide marching toward FDA submission and hopefully approval soon, people like Andrea have the option to find the medication best suited for them. And reason number 5, we are finally shaking loose the blame and shame associated with using medication to treat the chronic disease of excess weight. If your weight is higher than you'd like it to be, I hope you'll give yourself grace and consider talking with your doctor about whether or not weight loss medications might be indicated for you. Excess weight is not caused by a lack of willpower or a personality flaw, clearly. Rather, it's a complex multifactorial disease with causes that include, among other things, genetic, epigenetic, hormonal and endocrine issues, environmental exposures and toxins, medications like beta blockers, sleep aids, and meds used to treat mental health disorders. There are social and cultural influence as well. The infiltration of ultra-processed ingredients into our food supply is another contributing factor. So please be kind to yourself. Just like we don't expect someone to use willpower to treat their heart disease, we don't see willpower as a big factor in the treatment of excess weight. Okay, friends, it's time for our NBA. Time to set your next best action for today, meaning one thing that you're thinking about doing for yourself today in order to improve your health, to lose weight, or to increase your health span. Maybe you want to support someone you care about who's on a journey to lose weight by sending them this podcast. That can be an NBA too. Thanks so much for listening. If you'd like more support during your smart weight loss journey, check out our group coaching program at smartweightlosscoaching.com. Until next time, stay well and stay smart.